Hi, my name is Paul Bradley, and I'm a clinical psychologist who works with the neuroinflammatory service, and I'm going to talk to you a bit about coping with MS. Our team is a multidisciplinary team with medical doctors, nurses, a physiotherapist, occupational therapist. All of those have different expertise, experience and skills. My role within the team as a clinical psychologist is to provide psychological perspectives and assessment and support for people with MS and their close family members. We also aim to help all people involved, including my colleagues, to understand the psychological and emotional impact of the condition. Hopefully, already in your contact with the service, you have an understanding of how we work, and if not, then after today, you'll have a bit of a better idea about it. Just to start with, I have a quote here. It's a typical quote, which is not an unusual response to the news of first being diagnosed with MS. When I was first diagnosed, I had a strange physical response during the appointment. I felt as if I went down into a tunnel and my vision narrowed. I couldn't hear another word after he said it was MS. So MS is something that we've all heard of, but if you asked a member of the general public in the street, they might say something about wheelchairs or disability. The general idea and the stereotype is that of the most extreme or worst case scenario. And that's a frightening concept, and one which is only quite relevant to a minority of people with MS, actually. So anyway, we might come into our consultation to find out the results of, or the conclusions of our tests with some of this preconceived knowledge. We might have read some information on the internet, and there probably would have been some discussion perhaps about the possibility of MS, but nevertheless receiving the diagnosis is quite final, and the way in which someone responds to the experience varies a lot. We're all individuals, aren't we? So how did you respond, I wonder? What thoughts went through your mind? How did you feel? And what did you do? So here we have some typical reactions to hearing such news. Lots of different feelings. So many different feelings and strong emotions and different thoughts. It might feel overwhelming, but that probably would be considered quite normal, considering the circumstances. So some people might reach out to others, or they might pull away and withdraw. Some people might go on with their lives not really thinking about it. Or they might seek out loads more information, go on the internet, do Google searches. But receiving a definite diagnosis might actually be a bit of a relief for some people after a long period of uncertainty, and they might be able to understand their symptoms a bit better. They might now feel more able to tackle their problems as they know what they're dealing with. However a person reacts, or whatever they do or think, they're without exception going to be having feelings about it. So as we see here, this quote, feelings make themselves obvious sooner or later. They exist like toes or fingers as a natural part of you. And one person said here, I never knew I had so many feelings until I got MS. So due to the nature of the inflammatory processes, MS can affect people in multiple ways. And you'll be aware that each person perhaps is different, and the way in which they experience the conditions and the symptoms they have over the course of their lives is different. There's uncertainty ahead. It's a lot to take in, and no one can tell you how it's going to go for you. And this is just a list here of some of the symptoms that are possible. There are lots of ways of dealing with or managing these symptoms that may help you to feel better and that may improve your functioning. And the MDT and the NHS and other services out there like the MS Society are here to help you negotiate all of these different factors. But there are things you must do for yourself. And a big part of your challenge is to accept and adjust to MS being part of your life. Here's a quote to demonstrate part of the process of acceptance for one person. Frequently, the notion of acceptance is confused with surrender or giving in, but in fact, acceptance is what allows you to regain a sense of control over your life and your disease. The definition of acceptance is to regard as true, to take upon oneself the duties and responsibilities of. By fully accepting the diagnosis of MS, you begin to take responsibility for your health. It becomes your duty to learn all you can about the disease and how to manage it. Acceptance gives you the opportunity to begin making the best of what life has to offer you. It's not an excuse to throw up your hands and quit. Acceptance doesn't mean that you want or you like what you're accepting. It doesn't mean giving in. It also doesn't come automatically. It's a goal to work towards. It's a process of acceptance. Our degree of acceptance will fluctuate as time passes by and we experience different things. Some days we might feel more in acceptance than other days. So with the degree of this acceptance, you will be able to find a way to get on with your life as best as you can and make the most of it. As part of your care, we can help you on your journey of acceptance and adjustment, but ultimately you have to take responsibility and develop your own way of managing. While there are differences between all people, each has their own path to follow. There isn't a right or correct path, and it takes as long as it takes. So perhaps some indicators of acceptance would be that MS is no longer the focus of your life. Sadness, anger, and disappointment are more occasional emotions and not a way of life. And although you're optimistic, you accept that the disease may progress in the future. You continue to make plans for the future based on your current level of ability, with the understanding that these plans may need to be altered. In the event of a physical impairment, you are able to readjust your goals in work, play, and relationships to match your ability at the time. You're no longer consumed by fear of the future. You might be willing to accept help from others more than you were, while finding your own way to contribute. Regardless of physical limitations, you strive to maintain a positive self-image. You follow good health practices and avoid tempting fate with factors that can aggravate your condition. And you view MS as an added challenge to your life and not merely as the reason for all your problems. So I kind of like to look at self-care or self-management in this three-pronged way: the mind, body, and spirit. So if you can see this as a way of, that everything is connected. And in the middle there is wellness, if you're on top of all those three areas. So if we think about the spirit, that's our purpose, enlightenment, our connectedness, our life force, our determination, our direction, our faith, spirituality, religion, possibly. Our mind, that's thinking consciously, is thinking, cognition, reasoning things through, making choices. Unconscious mind would be the kind of beliefs that we have, our attitudes and our mood and emotions. They're kind of more automatic. And our body is our nerves, our organs, our immune, our endocrine system, our bones, but also our physical abilities and our symptoms. So what helps to promote well-being? Okay. So how do you get on with your life? So following the general advice for everyone about basic needs. So healthy eating and drinking, being aware of what you're putting into your body. How is it nourishing you? Eating a balanced diet and drinking plenty of fluids, the 5 a day thing in terms of vegetables. But be wary of restrictive diets and those claiming to help with MS. Do your research, do your reading. Keep moving, not necessarily taking up exercise, doing exercising and going to the gym, but don't give up activity. Make sure that you're moving your body, all parts of your body, if you can. What can you do in your life that will keep you on the move? Sleep and rest. Practice good sleep hygiene, which means regular timings, winding down and relaxing periods before bed, reducing caffeine and exposure to the digital media, the blue screens before bedtime, that kind of thing. Thinking about security, do you feel secure in your home? Are your living arrangements stable? Would there's something there be having an effect on you? Is your home comfortable? Do you have your favourite belongings around you? Meaningful activity. How are you spending your time? What's important to you? Is it work, domestic chores, a sense of achievement? What gives you your life meaning? Social interaction. Being and feeling connected to others, being part of something. It's important for all of us. We're social beings, aren't we? So family and friends, how are we connected to others? Probably a little less connected in the last year or so due to COVID. What about having fun? When was the last time you laughed? Has your life become dominated by MS and its symptoms? Are you still able to enjoy yourself in some way? What did you do in the past to have fun? What can you do in the future? So as I said, these are all general well-being things to think about, areas to think about for all of us. But when dealing with a condition such as MS, chronic health condition, even more important. And then perhaps going more specifically into developing your self-management strategy, that might involve consideration of some of the following. So there's a tendency for people with MS to focus on just the physical symptoms, and this can take over life because that's generally what the first indicators are. But research shows how emotions are intimately linked to physical health. There's a connection between the mind and the body. Stress does have an effect on our immune system and makes us susceptible to illness. And more than half of GP appointments we know for the general public involve stress-related complaints. So it's important to be aware that you also have feelings, emotions, and they are not something annoying and inconvenient that hopefully will go away, but they may give you important messages about yourself and perhaps clues as to how you might be able to make changes to improve your physical life. So rather than brushing them under the carpet or avoiding them and not wanting to make a fuss, learn to recognize and manage them. Use them as your guides. If you're more aware of feelings, then you will be able to develop ways of managing stressful times and anxiety. This might involve writing your feelings down in a journal, speaking to a close and trusted friend, or seeking counselling. Other ways of reducing the effects of stress and anxiety might involve joining a supportive group, whether that's particularly MS focused or related or not. It might be something completely unrelated. Obviously online mostly at the moment, but there are options out there. What about practicing relaxation or some meditation techniques? Mindfulness is really popular at the moment. You can access lots of different courses online. Or perhaps being more mindful during activities of your daily life. There are free open access stress control and mindfulness courses available in all health boards in Wales. And most books and information sources, many books and information sources available online. Perhaps getting out in nature would be good for you. It's important that you develop your understanding of how MS affects you in particular. So knowing your limits and your triggers, the effect fatigue has on you particularly, and any side effects from medication, which can be quite dramatic for some people. For example, keeping a record of your activity over the course of a week can help you to spot patterns between your activities and your symptoms, and then you can make adjustments to the future to limit the symptoms, yeah? Or even just to explain so that you know that if you do a certain activity that you might then have to rest up the next day. So there's also a need for you to monitor the effects of MS on you and make adjustments in your day-to-day life, like I just mentioned, at home or in education or work. And these might vary from time to time and could be temporary or more permanent. Some days you will be able to do more than others, and learning to pace yourself and not overdo it on good days is important. Depending on your situation, you might have to be more explicit about roles and duties around the house, for example. You may want to consider whether you need any advice and support to help you to stay functioning in education and work. There might be some adaptations available that might be useful for you. Alterations you could make to your schedule, perhaps, or strategies that you could devise for you to carry out your job more effectively. And there may be some particular self-help materials available for specific issues like chronic pain, sleeping difficulties, and fatigue. Your care and our understanding will benefit from your ability to communicate your difficulties and concerns clearly. So we do encourage you to keep diaries and lists, for example, about symptoms and difficulties, and to bring those symptoms to symptom management clinics or outpatient appointments. Sometimes important things can be forgotten during appointments, or something else crops up and it doesn't seem so important. So this helps us to keep track of things, and you. And we know from research and just from experience that people do better psychologically and physically if they take an active role in their care. So you'll be encouraged to make your own decisions with advice and support as much as possible at any point in your journey. And we encourage you to ask questions and express your concerns about what's going on. Your well-being is associated with your determination and your accepting the challenge and working on it to move on. Your challenge of living with MS may well be hard work and more or less undesirable at times, but avoiding the issues potentially means that you can get a bit stuck and suffer unnecessarily as a result. It's also important to know what is out there for you to draw on should the need arise, and also knowing how to contact or access these services is important. This would be those services provided by us, the MS team in the NHS, but also other NHS services. Also, this would include social services, general voluntary and charitable organisations, as well as more specialist ones like the MS Society and other community organisations. What's out there for you? MS brings with it a lot of uncertainty, and there is a need for you to be flexible in how you live your life. Old habits and routines may not now be appropriate or effective, and moving into the future, things may change. And you might need to develop, and you will need to develop new coping strategies. You might need to adopt them and adapt them to deal with any changes that might occur. So our team have years of experience between them and a great knowledge regarding MS, and you can draw on this knowledge to help you on your journey. So we can provide information and signposting and education and advice on MS. We can carry out specific assessments, for example, perhaps an occupational therapy assessment at home or work and help there, a physiotherapy assessment, or a psychological or cognitive assessment. As a team, we may carry out research to increase knowledge generally and audit to improve our service more specifically. Currently, we're involved in research looking at mild cognitive impairment in people with MS. So you might be asked in the future to take part in that. And we offer training to other organisations and also offer some information days like today for people who have been diagnosed with MS and their friends and family. So just to finish then, living with MS has many challenges, and promoting well-being gives you the opportunity to move forward and improve the quality of your life. So the more you look after yourself, the better. We encourage you and provide some support to help you to develop your own way of managing your journey. Okay, that's the end of my presentation for today.